How are thyroid disorders diagnosed?
Generally, when a patient with thyroid disorder walks into my clinic, first and foremost, a full detailed medical history, right? From that, I will be able to analyze in which category you're most likely in. And of course, a thorough clinical examination. So for that part, I'll be examining your thyroid gland. I'll ask you to swallow because all thyroid gland moves with swallowing as it's attached to your pretracheal muscle. So then I also would be introducing my laryngoscope into your throat, meaning I'm going to scope your throat. Why? To see whether you have any other complications, right? Complications such as eroding into your vocal cord, your vocal function, and so on. After that, I would be doing a full blood examination, especially to see your thyroid profile, T3, T4, and TSH, to see whether your hormones are in the normal level or is it hyper or hypothyroidism. All this will decide what kind of treatment that you are entitled for, okay? So then, in order to know how big the size is, whether it's compressing, how close is it to your carotids, how posterior is its extension, then you will be asked by the doctor either to go through an ultrasound, meaning scan of the neck and the thyroid, or in worst cases, if you suspect some other complications, then we'll ask you to do a CT scan of the neck. So after this, we have an idea of what we are dealing with. So in certain cases, I would advise patient to go for detailed examinations such as FNAC, meaning fine needle aspiration cytology. What I do basically is introduce 10cc or 20cc syringe with a blue or green size needle into that particular thyroid prominence and aspirate cells. So I'm only aspirating cells to decide whether your thyroid gland is normal, suspicious, or worst case malignancy. That's all. So this depends on both the medical history, blood checkup, as well as scope and ultrasound findings. You can obtain your diagnosis within the same day because blood test takes within 30 minutes to 1 hour. And then ultrasound also takes within 30 minutes. Worst case, if you require a CT neck, it's also done within an hour, right? Only thing that takes few days for confirmation is the FNAC because that needs to be sent to a pathologist to determine the cell cytology. So that takes the fastest within 3 working days or sometimes up to 7 working days.